Decisions, decisions. You know, they say not to make any rash decisions when you're going through a traumatic event. Yet, when you're diagnosed with cancer, all of a sudden, you're forced to make some really important decisions. I'm talking life and death. And when you're going through a cancer diagnosis, you are so overwhelmed, you are in the state of shock. It's hard to really absorb information. It's hard to take a breath and take your time to make those decisions. My name is Renee. I'm 39 years old and I'm a breast cancer survivor. And in this video, I want to talk about the options, the decisions for surgery and for reconstruction, and also how to talk to your medical providers to be able to gain as much information as possible so that you can make an educated decision and with confidence. So let's talk about when you are meeting with your surgeon to talk about surgery. Now, you are your own cancer story, your own specific journey that is particular to you. And so not every option is going to be presented to you that might be presented to somebody else or vice versa. So I want to talk about kind of all of the things and then the right questions to ask to make sure you're getting all that information and not just maybe what your medical provider thinks you want to hear or what maybe is the most popular decision, because there's a lot of stuff out there and also things are constantly changing, hopefully for the better. More options are out there. So when you meet with your surgeon to talk about your surgery, you may be a candidate for a lumpectomy. You may be a candidate for a partial mastectomy. You may be a candidate for a full mastectomy. Then you're also given the option to have a double mastectomy. You might be told that a double mastectomy is what is recommended because of other calcifications or things in the healthy breast. There are lots of options. So let's kind of break them down. Lumpectomy, meaning that the surgeon's going to go in and just remove, the tumor or the mass or the suspicious area and getting clean margins right around those cancer cells, getting enough out that there's nothing left over. Okay. Where is that happening? Where is the location of your tumor? Ask those questions. Make sure you're understanding exactly where. If you're having a partial mastectomy, what does that mean? How much tissue are they anticipating taking out? Is that going to leave, lumpiness and an indentation in your breast? If you're trying to preserve as much of your breast as possible, yet they're going to do a partial mastectomy because the tumor is larger, it will feel more like a mastectomy than it will a lumpectomy. A single mastectomy, that is an option to remove all of the breast tissue on one side. Double mastectomy could be offered maybe because for aesthetic reasons, if you're having a mastectomy on the one side, you have the option to go ahead and, remove the other breast, the healthy breast as well. Whether that be for cosmetic reasons to be able to feel, symmetrical, but it could also be that maybe there's a risk of cancer on that other side. I chose the double mastectomy. I've talked about it in my previous videos. I could have had a lumpectomy. I would have had radiation if I had chosen a lumpectomy. I chose the double mastectomy because I wanted to remove as much tissue as possible. And I also didn't want to have to worry about my healthy breast constantly going forward. And I'm so glad I did, because guess what? They tested the tissue after my double mastectomy and there were precancerous cells in my healthy breast. So that was the best decision for me. Other types of surgery to remove the tumor could also be what's called aesthetic flat closure. Some women choose to say, take all the tissue and I don't want to be reconstructed. I'm fine being flat. And instead of just removing the tissue and it looking, like a smaller chested person, it actually, the way that they do the incisions, it's aesthetically flat. It just kind of looks nicer and neater. You can Google images and find some things out there for what aesthetic flat closure looks like. Be sure to ask the questions. Where is my incision going to be? Is that the only place? Is that the only option? Okay, so if you're having a mastectomy, is the incision going to be underneath? If you're not preserving your nipples, is that going to be in the center? Is there an option to do it underneath on the side over here? Just ask those questions. What are the pros and cons of having this surgery versus another surgery? Most medical professionals will tell you that the survival rate of a cancer patient is the same with a lumpectomy as a mastectomy. But I will say, in my own research and being in this breast cancer community, it's more about the chances of recurrence. It's not 100% that you won't have a recurrence when you have a mastectomy or double mastectomy. But it seems to me in the stories that I have heard that those who choose a lumpectomy eventually have a mastectomy later because they've had a recurrence. So it's not guaranteed, and everybody is different, and I'm not making this video to say that you shouldn't have a lumpectomy. I just know for me, I thought if it comes back after a lumpectomy and then I eventually have to have a mastectomy again, another surgery down the road to have that mastectomy, I want to do it now. I'm done with them. They've fed my children. I'm good. So that's why I chose the mastectomy. So just do your research. Ask those questions. Ask your surgeon, how many of this type of surgery, how many have you performed? Nobody wants to be the first or even the 10th, right? Your doctor will not be upset if you ask those questions. How many have you performed? What are the complications of this surgery? What can I expect in terms of, if you don't get the clean margins, what happens next? What type of surgery will you want to do? What is the recovery like for this specific surgery? Try to think of as many questions as you can of all of the what ifs, because they might not come out with those things because they don't want to scare you. They don't want to tell you, the very small chances of those things. But if you ask, they will answer that question. Okay, let's talk about reconstruction options because there's a lot. Now, it depends on what you are a candidate for. I was a candidate for skin sparing and nipple sparing. You may not be. You might be a candidate for deep flap reconstruction. I was not. It's all about your body type, your BMI, also, any other health conditions you might have, diabetes, if there's anything underlying, make sure you're telling your medical team about all those things. They should know all about that. But in terms of reconstruction, there's quite a bit. There's reconstruction, obviously, with implant. So some people go direct to implant. So right at the mastectomy, instead of doing the expander, which I've talked about, they go direct to implant. Your doctor may not recommend that because if you are going to have radiation or there's a chance of radiation, you don't want to radiate on an implant. So you're kind of taking a risk, rolling the dice of going direct to implant without putting the expanders in. Expanders kind of give you that, it's like a bridge in your reconstruction just to kind of wait and see. And if you're not going to have radiation, if you are going to have radiation, you can have radiation with the expander in. So just make sure you ask those questions. So there's implant reconstruction, deep flap, which I've said before, is about taking tissue, usually from your abdomen, and creating a breast with that. That's a big surgery. That is a lot in your, a huge incision all along your abdomen. Definitely ask about that. Ask about the recovery from that. There is reconstruction using other tissue and fat grafting, from other parts of your body. A new reconstruction for women who are built larger with, originally large breasts. There is what's called a Goldilocks reconstruction, where they basically use the skin to mound and form into a breast mound. Instead of using other parts of the body, they can take the skin. So let's say somebody is large chested and has a mastectomy. Instead of going the reconstruction route with other major surgeries while they're in the mastectomy, they just fold the skin underneath to form a breast with that. And that's good for people, like I said, with larger chest, because you need a lot of skin to be able to do that. So just ask all the questions to your doctor of, what are my options? What am I a candidate for? Where are my incisions going to be? If reconstruction fails, what does that look like? Talk to me about touch-ups or revisions is what they're called. So, what type of revisions will I need? Because you might have a reconstruction surgery and not be told that down the road they might need to do some revision. And so you just don't want to be, kind of, unaware of those things. Of course, those are smaller surgeries, but just to kind of know all of those things. And again, I've said before that your doctors are not going to really tell you their opinion. They will give you recommendations and say, you choose. But I have found the phrase, if I was your sister or if I was your mother, what would you recommend? And I find that to be able to get the best personal recommendation. Also, if you can take the time when you are doing all of this to get educated, to get a second opinion, maybe even a third. It is not to discredit your medical team that you have in place. It is literally just to hear options and make sure that you are being exposed to all of your options and giving you the confidence to be able to say, okay, so-and-so told me I should, or recommended this, and this doctor recommended this too. So I think that feels good. That feels good. Kind of have to do what feels good. And getting those second and third opinions are going to help give you the confidence to make those decisions. Remember, it's not a marathon. I'm sorry, it is a marathon. It is not a sprint. Okay, it's not a sprint. Take the time, take a breath. Ask as many questions as you can so that you can be informed. I hope that this video helps you if you're diagnosed. If you know of anyone diagnosed that is facing these tough decisions, please share this video, just to be able to, get the word out there that, you are your own health advocate. Thanks, guys. Talk to you later.